Medicare Advantage plans often get a pretty bad rap, but there are some notable exceptions, such as DSNPs. So if you are eligible for a DSNP, are they worth it? Are there better options? Stay tuned to the end of this video to find out. Now, we say this all the time, and it really is true. Medicare offers really comprehensive and quite excellent coverage. However, for some, it can be a struggle to pay those premiums and deductibles, copays, and coinsurance. And then there's that issue of the no out-of-pocket maximum with original Medicare alone. So if your income falls below a certain threshold, you may be eligible for Medicaid in addition to Medicare. If this is the case, then you're what's known as dually eligible, and you can look into a dual eligibility special needs plan. But first, of course, you need to determine if you are eligible for both Medicaid and Medicare, and then see what plans are available in your area. So what are DSNPs? Well, as I said, they are dual eligibility special needs plans that combine all of the benefits of original Medicare, which is Medicare Part A, basically your hospital or inpatient insurance, and Medicare Part B, which is your medical insurance anytime you see a doctor. Plus, they will also offer the full benefits of Medicaid. A brief pause here. If you are interested in enrolling in a DSNP plan, you can reach us in the comments below with any questions or at the number on the screen. There is, of course, no charge for our services, and we are licensed nationwide. And please make sure to like and subscribe to stay up to date. All right, back to it. Not only will DSNPs offer the full benefits of original Medicare plus those of Medicaid, but they often throw in a few extra benefits for good measure. Now, Medicaid is a program that is run not only by the federal government, but by the individual states themselves. So the states do have a modicum of control over the amount and type of duration of services, but at the very least, they must meet federal guidelines. And some states do choose to offer more expanded Medicaid programs than others. That being said, if you are eligible for a DSNP, then these plans will offer you the full benefits of Medicare A, B, Medicaid, and of course prescription drug coverage. So you can expect that your plan would offer benefits such as inpatient procedures, outpatient procedures, skilled nursing facility care, nursing home care, hospice, preventative services, mental health services, medical equipment such as wheelchairs and walkers, prescription drugs, dental, vision, hearing, transportation, and more. So the list is truly extensive, and you can see why these types of plans are so very appealing. And of course, they're often offered at a much lower cost, which we're going to talk about in just a minute. So not only do plans offer things like transportation to and from appointments, but very often the dental benefits that they offered would be better than those offered by a regular Medicare Advantage plan or Medicaid in general. And some plans might even offer things like meals. So yes, these types of plans do offer excellent and extensive benefits, but because they are Medicare Advantage plans, they're offered by private carriers, and those benefits and networks can vary widely. It's much harder to shop Medicare Advantage plans as opposed to something like a Medicare Supplement plan. So for this, we really highly recommend that you work with a broker. In order to be eligible for a DSNP, you must be eligible for Medicare and Medicaid. Now, eligibility for Medicaid is largely determined by income, household size, certain medical criteria that you might meet, and of course, your state's regulations. However, you're most likely eligible for Medicaid if you make less than 100 to 200% of the FPL, which is federal poverty level, and you're pregnant or elderly or disabled and or the parent or caretaker of a child. If you make less than 133% of the FPL, then it's likely that you will still be eligible for some type of Medicaid assistance, but again, it is largely determined by your state, and many states have expanded their Medicaid programs. There are additional non-financial criteria for Medicaid as well. Generally speaking, you have to reside in the state through which you are receiving your Medicaid. Also, you must be either a citizen of the United States, or there are certain non-citizens that can apply for Medicaid as well, for example, permanent legal residents or aliens. And then certain groups are limited by status such as pregnancy, age, or parenting status. States also have the option to establish a medically needy program. So for example, let's say based on your income alone, you might not qualify for Medicaid. But if your medical needs are so extensive, meaning your medical bills are so very high, then you may be able to spend down your income, which might make you qualify for Medicaid. Luckily, most states have actually adopted this medically needy program. In addition to comparing the actual benefits of the plans and networks of the plans, determining if you're eligible for Medicaid is probably one of the trickiest parts of enrolling in a DSNP. And because eligibility does vary from state to state, we highly recommend that you log on to Medicaid.gov or contact your local Medicaid office. Now, of course, in order to enroll in a DSNP, you not only have to be eligible for Medicaid, but Medicare as well. So you'll be eligible for Medicare if you are over 65 and a U.S. citizen, or a permanent legal resident alien who has lived in the United States for at least 5 years. And you also need to be eligible for Social Security benefits or railroad retirement benefits, either through your work history or your spouse's work history, which basically amounts to 40 quarters, which is about 10 years basically. Even if you're not collecting the Social Security benefits yet, you do need to at least be eligible for them. You can also be eligible for Medicare if you're under 65. If you have been collecting Social Security benefits for at least 24 months, and those months don't have to be consecutive, then you can be eligible for Medicare. Also, if you have ALS or end-stage renal disease, then you can be eligible for Medicare if you're under 65. In order to enroll, you'll need to provide documentation confirming your eligibility. So you'll need to provide your Medicaid card. If you are not yet receiving Medicaid, but you believe that you are eligible, again, please contact your local Medicaid office. Once you have the necessary documentation, you can either enroll during your individual open enrollment period, which would be the 3 months before you turn 65, the month of your 65th birthday, and the 3 months thereafter, or during the AEP, which is the annual enrollment period, every year from October 15th to December 7th. During this time, you can join plans, switch plans, or drop a plan. And even if you are happy with your plan, we highly recommend that you review the new plans available every year to make sure that you're still enrolled in the best possible plan for your needs. Because DSNPs are Medicare Advantage plans, they are offered by private carriers and they operate within networks. Now, unfortunately, most DSNPs are actually offered as HMOs, which means that you need a PCP, which is a primary care physician, and you will need referrals to see a specialist. There is also no out-of-network coverage, except in the case of a true medical emergency. There are, however, a few PPOs. But if you want to view the available plans, then you can log on to Medicare.gov to see what's available in your area. Finding DSNPs on Medicare.gov is pretty simple. You just scroll down to where it says Find Plans Now. Put in your zip code. I'm going to put in a Florida zip code. We're going to look for Medicare Advantage plans because DSNPs are Medicare Advantage plans. You click that you are eligible for Medicaid. If you have both Medicare and Medicaid, you might qualify for a type of plan that helps coordinate your Medicare and Medicaid benefits. These are called dual-eligibility special needs plans, which we've already discussed. Those are DSNPs. So I'm going to click eligible for Medicaid, continue. It's asking if you want to see your prescription drug costs. If you do have prescription drugs, please click yes, you can compare. And ta-da! Here are all of our DSNPs available to us. So you'll see that there are many plans with no additional monthly premium. That's all of those. And you can even, if you wanted to, just filter by lowest monthly premium, lowest drug deductible, lowest health plan deductible. Let's see if any of them actually even do have a monthly premium since we're talking about DSNPs. Just curious here. Let's see. Lowest deductible. Now, I haven't scrolled through all of these, but since I'm filtering by lowest deductible, I'm thinking that most of these don't have a monthly premium. That's pretty common with DSNPs because, quite frankly, there are many Medicare Advantage plans, regular Medicare Advantage plans that don't have an additional monthly premium. So with DSNPs, since you're getting those additional Medicaid benefits, it's even more likely that you'll find a plan with no additional monthly premium. You do need to continue to pay for Part B, though. Okay, but I am going to go back and filter the other way, or rather sort the other way. Okay, if you want to see more benefits. Now, if you want to add to compare, let's just pick 3 plans to compare. Actually, I do also want to see if there are PPOs available because, as I mentioned, usually most of the plans are HMOs. Let's see if there are any PPOs available. Oh, there are PPOs available. Then again, I am looking in Florida where there is a better selection of Medicare Advantage plans, but you can see of all of those plans, only 23 are PPOs. Let's look, and yeah, you're going to have higher out-of-pocket maximums, but so much more flexibility. Now, if you want to look at all of the benefits, you click on Plan Details. Scroll down. You can click on these tabs if you'd like as well. But here we have total monthly premium. You still have to pay for Part B, of course. Sometimes there can even be a Part B premium reduction. No deductible. Health services, so this is your out-of-pocket maximum for these plans. Primary care doctor. 0 if in-network, 65 if out-of-network. Here are all of your sort of basic services. More services available. Let's see. If you had put in your prescription drug information, it would show you that information here. All right, it does seem to offer hearing and even hearing aids, which is great, although they are available over the counter now. Offers preventative dental, comprehensive dental, not for endodontics. Extractions aren't covered. That's interesting. Some vision benefits. If you want to see more extra benefits. And that's basically it. Now, if you did want to compare multiple different plans, you just click Add to Compare. You can do up to 3 of them. Add to Compare. Add to Compare. Then you compare, and you'll be able to see a quick snapshot of all those different benefits we just looked at, but with 3 on one page, so you can more easily compare the different costs and benefits provided. If this is the route for you, then you can either contact the carrier directly or work with a broker, which is, of course, our #1 recommendation because they can help you compare multiple different plans offered by multiple different carriers. Your costs for a DSNP will vary by the plan that you choose and the state in which you live. Now, of course, because they are Medicare Advantage plans, they are still beholden to the same rules of Medicare. You may still have copays or co-insurance and deductibles. However, you can expect that they will probably be lower than original Medicare alone. Additionally, you may have a monthly premium in addition to your Part B monthly premium, or possibly not. Again, it really just depends upon the plan that you choose. Now remember, because DSNPs are Medicare Advantage plans, there can be the same issues that many people experience with Medicare Advantage plans, i.e. those very restrictive networks. Very often people report that they have difficulty with Medicare Advantage plans because they can't find local specialists or maybe even a hospital that accepts their plan, and therefore they have to travel extensively. And then there's also the issue of pre-authorization. Because these are managed care plans, that means that if your doctor recommends a certain service or treatment, your plan must first approve the service or treatment before you can actually go ahead and go have it done. Now, there are other programs that you may qualify based on your income. For example, there are Medicare savings programs, which would allow you to keep original Medicare instead, but offer you assistance with premiums, deductibles, copays, and coinsurance, or possibly enroll you in the Extra Help program, which is part of Part D. If you do want to learn more about that, then I highly suggest you check out this video over here. And if you want to learn more about Medicare in general, make sure to check out our All About Medicare playlist. As always, if you have questions, you can reach us in the comments below or at the number on the screen. There is no charge for our services, and we are licensed nationwide. Please make sure to like and subscribe, and we'll see you next time.